Okay, and I'll hand over to Andrea.
Thank you very much, Nessa. Good morning to everyone and welcome to this Scirocco Exchange webinar, COVID-19, mental health and well-being of healthcare professionals. So this webinar is organized as part of the EU Health Program funded project called Scirocco Exchange, which focuses on the capacity building support for integrated care. So we work with 9 health and social care authorities across Europe on how we can improve their ability to implement and scale up integrated care. And the primary driver of this capacity building support is mutual learning, exchange of good practices, experience, so that we don't duplicate the wheel, but we rather learn from each other rather than learning from each other. So today, the topic is the mental health and well-being of healthcare professionals, which was the topic identified by one of our pilot sites that is part of the consortium, who would like to learn about the experience of other regions. So we will be looking at the experience of Scotland and South Denmark in particular. And first, we will start with some overview or setting the scene. What was actually the impact of COVID-19 on health and social care professionals? More concretely, we'll be looking on nurses and midwives in one of the biggest hospitals in South Denmark. And then this presentation will follow by the good practice or experience from Scotland, where we will be looking at the development of Promise, which is a national well-being hub for those working in health and social care in Scotland. So it's more kind of like that intervention perspective, what we have done to cope with COVID-19 and the impact on well-being of healthcare professionals. So we will start first with Mette Maria Skjol, who will give you the, as I said, that kind of like setting the scene, what actually the impact has been, and then we'll follow. And then, as it was said in the introduction, we will have plenty of time for a discussion, sharing the experience, what's going on in our respective regions in that area as well. So without further ado, I'll hand over to Mette Maria to kick off.
Thank you, Andrea, and thank you, Nessa, both for having me here today. I'm very happy to present one of our projects here from the University Hospital in Odense. My name is Mette Maria Skjol, and I'm the head of the department for dermatology and allergy, and also the vaccine centers here in the region of southern Denmark. I also do a lot of research, mostly in the area of the IT. I worked many years with IT in the area of IT and innovation, but also in the area of nursing. And today I'm going to tell about one of our projects about the psychosocial impact of COVID-19 on our nursing and midwifery staff here at the hospital. Yes. So this is actually a big collaboration. My colleague from the hospital, Mette Udman, and I has done this Danish project, but in collaboration with an Australian research group with Dr. Sarah Holton, Dr. Karen Winter, and Smollett Truman, and also Professor Bodil Rasmussen, who is running the exact same project in Australia. And many of our tools has been developed in Australia and translated into Danish. Thank you. Yeah, so COVID-19 in Denmark, we had our first patient in the end of February 2020, and like the rest of the world, everything happened very fast after that. And in March 2020, we decided to do the big lockdown with all non-essential services and also our schools. And then from March 2020 until now, it's been an on-off period for that area. And also the health service in Denmark, of course, had to do a number of initiatives to meet this pandemic, both in connection with the PPE and the visitor restrictions, but also saw an increase in telemedicine and the whole video consultations, and a huge reduce in having patients into the hospital. Yes. Of course, nurses and midwives played a major role in this, and they are the nurses are the largest clinical group who had the most direct and intense patient contact. So of course they were the major frontline healthcare workers with respect to the pandemic. And a lot of the nurses here at the hospital, around 3,500 nurses and around 200 midwives, definitely experienced over a short period of time a huge change in the way they worked. Of course, it was a major increase in the workload through the pandemic, not because we had a lot of patients, but we had a huge a group being ready for having a lot of patients. So that change at the whole hospital were quite intense. Most of the nurses all over the hospitals, whether they had COVID-19 patients or not, had to adapt a lot of new ways of working, using a lot of equipment for protecting themselves and protecting the patients, and to avoid the risk of containing each other and also the patients. And a lot of nurses had to change the way they work and also where they work. So, and especially the last part, was a huge challenge for some of the nurses to have redeployment over a short time into new wards. Some of the nurses maybe worked with ambulant patients or outpatients clinics, and suddenly had to go into the area of intensive care unit. So huge change for the nurses during this period. Yeah. So this study was done to assess the psychosocial impact of COVID-19 and all the things I just mentioned on nurses and midwives in Denmark. We wanted to identify the personal and the work concerns that the nurses had during this outbreak. And we also wanted to see whether the level of emotional distress was affected in this period. And of course, secondly, we wanted these findings to prepare the whole healthcare system to have new responses in the case of new infectious diseases. Yeah. Yeah, so what we did is that from the period of May 13th to June 12th, 1 month, we had an online, anonymous, self-administrated cross-sectional survey. So we had a survey with around 80 questions, and we distributed this survey to all nurses and midwives employed at Odense University Hospital. We have a research unit at the hospital called Open, and they have access to huge databases, to building huge databases in like overnight. So in just 1 week, we had established from Australia this survey, and had all the data assurance and acceptance in-house, and was ready to distribute this to the emails of the nurses. So our IT department found the 3,700 email addresses for the nurses, allowing us to send out this survey. Yes. Yeah, so it was sent out to approximately 3,740 nurses and midwives at the hospital, and 1,390 completed the survey. So all in all, we were quite happy about that. It was quite high actually compared to the Australian survey, and I think we had really good access to the nurses here, because the nurses have a culture where they regularly check their emails. So lucky for us, yes. Yeah. Yeah. So on this slide, you see the socio-demographic characteristics, and what you can see is, not surprisingly, that the major group is women, mostly women, completed the survey, and the mean age was around 40. What is also interesting is that we asked them to self-rate their health, and they actually perceived their health as quite good. So that was a starting point for the survey. Yes. Yes, and in the questionnaire, the staff was asked to complete a depression, anxiety, and stress scale. That's an internationally validated scale that we also used in Australia to measure the emotional state of depression and anxiety and stress. So the first column is Oho, and the middle one is Melbourne. And the last one is an elderly survey done in Sweden on midwives. But if you take the Danish one, you can see that even though we were in the middle of a pandemic, the nurses' states for all three areas were rated quite high at the University Hospital in Denmark. So the grounding and the whole mode of the nurses is quite strong for Denmark for a start. Probably has been yes. So on this slide, you see some of the results of the impact on the COVID-19 on the staff. I think if you press one more time, I think we'll have a, yes, exactly. So you can see that the staff is only slightly concerned of falling ill themselves as a result of having COVID-19, but they are very concerned about passing COVID-19 on to family members, and also very concerned about their family's health. Much more concerned about the family than they are about themselves. So people were really frightened about bringing COVID-19 home to their family, to the kids, and getting the whole family isolated. Yes. So So that has some limitations for the staff, of course. And I think if you press one more time, I think we'll have some colors. Yes, and one more time, I think. Yeah, just press 3 more times, I think. Allow us. Yes, thank you. Sorry. So here you can see the impacts on the work that the nurses did. And as you can see, about 60% felt that their job put them into risk of getting COVID-19. And about nearly 30% felt that they had more stress at work. And 74% reported that they had to do tasks that they wouldn't normally do. So that was a whole new situation for them, both on the society side, but also on the work side. And 12% actually considered to resign due to all this, and maybe due to something else. We don't know. We don't know what the number would be if we hadn't had COVID-19. And like around 27% felt that they were completely not prepared for taking care of patients with COVID-19. On the other hand, about nearly 50% felt the sense of increased togetherness and increased collaboration among the staff and among the hospital. And around 70% felt that this has been definitely a learning experience. Yes. And just press 2 more. Thank you. And so finally, we also asked the staff about how they felt about the hospital's response to COVID-19. And the result actually shows that the first acute phase was handled quite well. Like 82% found that the hospital were prepared, and also that the use, including the use of PPEs and communication and training. However, the staff found that the hospital's concern about the physical and emotional well-being was poor. So the hospital was very ready on the actual things that must be done. We need to communicate out. We need to have masks. We need to provide some training. All that was put into scale, but nobody really asked the nurses, how do you feel? has this been stressful for you? How can we help you on extra concerns? And then that whole area wasn't dealt with in the same way. Yes. Yes. So in the end of the survey, so that was a little bit peek into the survey. And so what we also asked them was if they had any comments for us. So 218 of the respondents actually provide us some extra information, and we have categorized that into 5 groups. And the first group was information around the management and communication at the hospital, where some of them wrote that there's a need, there was an increased need for more information, and also nurses wanted to be involved more in the decision. It was very top down. They also want acknowledgement more, that it would be nice if people had said, well, thank you very much, and we know that you handled it very well. And there also was a lack of follow-up on all the official announcements. In this period, a lot of information was coming from the ministries, and the whole communication before it reached through the nurses, there was a lack in time. Then there was a whole area of new clinical guidelines, frustration about having to deal with change in guidelines ongoing. Some of them felt that whenever they came into a new shift, there was new guidelines. And also adherence to the guidelines was difficult because you couldn't have, for instance, the distance requirements. It was very difficult to due to the buildings to cope with those, and also lack of confidence. Is this right? Is this really true? What we're writing, because everything happened so fast, so it wasn't really research based like it normally is. Yes. So, and on the organizational area, there was, of course, the whole frustration related to relocation and redeployment, and also they felt distance from their normal colleagues. On the other hand, they felt that there was an increased unity among the staff at the hospital, and that we had to do the feeling of doing something together for society. And then the whole area of the personal protective equipment, that has been very time consuming for the staff to use this. And in the beginning, of course, the whole discussion around not having enough of this, I mean, that was dealt with quite fast. Yes. And then the whole area of staff health, there was a concerns about what can you do when you're pregnant? Can you go to work? Do you need to stay home? That whole discussion wasn't really dealt with in the beginning. And then increased awareness of the whole value of health against your work. Yeah. Yes. Yeah. So some of the initiatives that we have been taking based on this survey has been, of course, a close feedback to our board of directors, preparing for like a new pandemic, or preparing for the step 2 and 3 in this pandemic, wave 2 and 3. Then we have had the feedback to the staff, to all the ones who brought data into our survey, and we have done several oral presentations to spread out the word to other organizations. And then at the moment, we're working on a publication from the Danish side, but also a merged publication from both the Danish and the Australian side. And then we are continuing our collaboration with Australia in this area of the psychosocial initiatives for the staff. Yes. Thank you very much. And if you have further information, or you want further information about the survey, of course, feel free to contact me or my colleague. We still have some data that are being held back for the publication side. So hopefully more is to come over the next month. Thank you.
Thank you very much, Mette Maria, for this very informative presentation. And so, as I was saying, we'll now move on from this setting the scene to more kind of like intervention presentation. So we will have Dr. Claire Wifey and Sarah Phillips, who will talk about development of National Wellbeing Hub in Scotland. So over to you.
Thank you, Andrea. Can you hear me okay? Yeah.
Yep.
Yep. Okay, good. Thank you very much for asking Sarah and myself to tell you a bit about the National Wellbeing Hub, which is a new website that we created last year to support the health and social care workforce in Scotland. Next slide, please. So the context for this, as you will know, was the pandemic. Scotland went into lockdown. This is our First Minister, Nicola Sturgeon. We went into lockdown in March of last year. And next slide, please. And just to give you a bit of a background into how things are organised in Scotland, we have a number of partnerships which are called health and social care integration partnerships. So our infrastructure is well designed to support mechanisms or vehicles to help the health and social care workforce. So there are well-being leads, people who lead the partnerships in each of these areas of Scotland. And these leads were very important in the development of the website. So the Scottish Government commissioned us, next slide please. The Scottish Government asked us to develop the website. We were a small team. We already existed under the name PROMISE, which stands for Psychosocial Response to Major Incidents Scotland. So this was a collaboration that existed for the last few years to facilitate the psychosocial response of people to emergencies and disasters and major incidents. So this is a collaboration between, on the left, you'll see the building there is the Rivers Centre, which is the specialist trauma service based in Edinburgh in Scotland. And on the right, there is the base for the Anchor, which is a specialist trauma service in Glasgow. So these two trauma services collaborated to create this new website called the National Wellbeing Hub. Next slide, please. It was a very big ask. The workforce in health and social care workforce in Scotland is about 360,000 people. So a wide range of professions and disciplines and jobs. So we needed to work together with a number of different organisations. These are the major ones that we worked with. Next slide, please. And the website was launched in May of last year with the aim of providing a whole range of resources and support for the range of staff right across the range of health and social care, and including unpaid carers. So these are people perhaps who are at home looking after a relative, the people who are not paid staff, but who had a very key frontline role during the pandemic. So we based the website on the principles of psychological first aid. I'm sure you'll be familiar with this model, which is what the evidence tells us should form the basis of any psychosocial response to a major incident or emergency, such as the pandemic. So firmly based on the principles of psychological first aid. Next slide, please. That's what psychological first aid looks like. It has 7 key components. They don't come in any particular order or priority, but these are all the essential components that a good response to an emergency should consist of. Next slide, please. So on the website, where the way we set it up last year was that there were 3 sections. One was a section aimed at individual people, another section aimed at managers, people managing the health and social care workforce. And then the 3rd section was about how to find help, particularly help in your local area. Next slide, please. So in the individual section, help for individuals, again, remember this is based on principles of psychological first aid. We put lots of resources to help people with their needs at home, their needs in the workplace, difficulties they may be having in relation to family, friends, and their colleagues, and a large amount of information and help in sections on coping and self-care. Is it normal to feel like this? Normalizing people's reaction to the pandemic. And then a separate section for unpaid carers. Next slide, please. So this is just an example of this is a screenshot of what one of the pages on the website looks like, your needs at home. And you'll see that there are several titles there that you can click on, and that will reveal the information under that heading. So how can I get help with childcare? Sorry, my cat's helping me do the presentation. Childcare or homeschooling, how can I juggle working from home? So you'll see the type of everyday problems that people might be facing at home, and this is where they would find help for those. And you'll see on the right hand side there some short video clips of people, real life, ordinary people, just talking about how they've been coping with these major issues. Next slide, please. And then the section on managers gives some tips and advice on leadership, how people can support their teams. There's a section for the latest research and guidance, just to make it easy for people to keep up to date with the research that's coming out on supporting staff. And a section for employing a personal assistant at home, and then management support as well. Next slide, please. So again, here's an example of one of the pages in the managers section. This is the research and guidance bit, and if I were able to pan down, scroll down on the website, there would be a list of all the links to the research papers and the latest findings in this particular field. And again, video clips on the right hand side, just to bring things to life and hear experts talking about these areas. So next slide, please. And the 3rd section in terms of content was aimed at helping people find quickly the right help that they needed. So a map of Scotland that you can click on to find help in your local area, all the national services, helplines, organisations, third sector organisations that support staff, professional groups. So really a one-stop shop, one place that people could go to find the help that they might be looking for. Next slide, please. And this is just showing you the map. So if you were to hover your cursor over your mouse over the map of Scotland on the left there in your particular area and click on that, then it would take you to all the resources and support mechanisms that would be available in your local area. And on the right there, you'll see listed other national services, unions, professional groups, and third sector support that might be relevant to you. So really just trying to pull together all the sources of support that are available to this staff group. Next slide, please. So that's just a summary of the kind of things that are in this big toolkit for staff. So lots of psychoeducation, supported by short bite-sized videos, a whole series of PDFs of top tips to make it very easy and quick for people to access information, downloadable apps, podcasts, webinar series, and all sorts of other websites that might be helpful. Then there are links to those websites on the hub. Next slide, please. So the challenges that we've had, we did this very, very quickly. We set this up in a period of 3 weeks, working night and day really with our partners to try and put this together. One of the challenges was the breadth of the audience that we were aiming at, from doctors, surgeons, cleaners, people caring for relatives in the home. You can imagine the range of need was very wide indeed. The landscape was very fast moving. There were new guidelines being issued by the Scottish Government weekly, if not daily, and we had to try as best we could to keep up with the changing landscape and the developments during COVID, keeping up to date and responding to the needs that we were seeing being identified. And the last one there, equality of access, is just referencing how challenging it was to make sure that everybody in this broad audience had equal access to these resources. Next slide, please. So just quickly to tell you how this went, we launched, as I said, in May of last year, and we've had more than 100,000 visitors in the first year. So quite a good take-up rate. Most of the visitors, as you would expect, come from Scotland, mainly from the main cities of Glasgow and Edinburgh, but a certain percentage from the smaller cities. We've also had visitors on the site from China and the USA, surprising number from overseas, but clearly other countries are interested in this, this resource. Where the visitors to the site were located, where they lived, did not correlate when we did analysis, did not correlate with where the cases of COVID were. Next slide, please. And of interest to us was that the pages that were visited most were the individual pages rather than the ones aimed at managers. And in particular, always, and this was a consistent finding, that people visiting the site were looking at the coping and self-care sections and pages, and also, is it normal to feel like this? So there was clearly a demand to try to manage, self-manage, self-help, and to normalize what people were feeling. And again, interestingly, the pages that were about COVID specifically were the least visited, and the pages that were more general in their advice and their tips were of more interest and visited more by people. Next slide, please. Some of the mistakes that we made was they were really technical mistakes, and if we were setting up another website, we would do it differently. So we did not build in a way to analyze the demographics of our website users. So it's difficult to tell who is using the site. It's also difficult to tell what specific resources are actually being used and downloaded. And again, very difficult to know whether people are finding what they are looking for when they navigate the site. Next slide, please. I'm going to hand over to my colleague Sarah now, who's leading the development and the maintenance of the site, and she can tell you how things have been going just recently.
Thanks, Claire. So next slide, please. Currently, the homepage looks like this. Along the top bar, you've got a link to the different sections. And if you click the individuals link at the top, you'll get a drop-down menu with links to the 6 individual pages that Claire mentioned earlier. Likewise, if you click on the managers, there'll be another drop-down bar with the 6 pages there. And then in the center of the page, you've again got the big buttons in the middle for individuals and managers. So if you were to click on the individuals button and then clicked the link for coping and self-care, you'd come to a page that looks like this. Next slide, please. Each of these lines of blue text has a post behind it. So you can click on the sections to open and close them and read what's in there. On the right-hand side are videos with content to support the posts. And over time, we've reorganized the ranking of the posts to reflect what has been important through feedback from the wellbeing champions. There are limitations to how the site is structured. As Claire mentioned, people have to click through too many things to find the information that they're looking for. Due to the design of the site, with all the drop-down posts being part of one large page, it means that a search result will return with the full pages, and then the user has to go through each post to find what they're looking for. So with that in mind, we've been working on redeveloping the website, and the new homepage is going to look like this. So next slide, please. And this is currently a draft, so any text and pictures are just placeholders at the moment. So the final version won't be asking if you work in primary care. And as you can see, instead of having buttons for individuals and managers, there's just one menu to access help and support. So along the top, people can click on that menu and there'll be a drop down with the topics that are covered on the site, making it a lot easier for people to find what they're looking for. And if you were to go into that menu for help and support and click on one of the topics, it would take you to a page that looks like this. So next slide, please. And again, this is just a draft for now, which is why all the posts are saying the same thing. And each of these bits of blue text with the pictures next to them are individual posts. So they're replacing the drop-down sections that I showed you on the coping and self-care page. And it will just make it a lot easier for people to find the items that they're looking for when they use the search function. And it's also going to enable us to track which posts have been opened up, resulting in us having a better understanding of what people are looking at when they visit the hub. Next slide, please. So the second phase of the hub has been about redesigning, and we're nearing completion, and we're hoping it'll be ready to go live towards the end of June, early July. And as we're going, we're augmenting the content. And the third phase of the hub is going to be trying to open up new channels of engagement to make the hub feel far more interactive. And we have a number of social media channels. So we have Twitter, Facebook, Instagram, LinkedIn, and YouTube. And at the moment, we're still working out how best to use each of these. As Claire mentioned, we've been running a webinar series, and there's going to be a new program which will run through the summer. So far, previous sessions for the webinars have been well received, and we've had approximately 12,000 people sign up for the 20 sessions so far. We're also recording the webinars so that they'll be available to watch on the website going forward. And then finally, we're planning on introducing a moderated online forum with the intention that it will provide a safe space to start conversations around well-being amongst the workforce. So there's a lot of work going on at the moment on developing the hub. Okay.
That's me, the last slide. Right, I'll just stop sharing and let people come in. So Andrea, I'll just encourage people to put on their cameras. Is that good? If you want to join the discussion.
Absolutely. So we'll I'm just looking through the chat as well. Okay, so we'll be taking the, as I can't hear you.
I was just saying I wasn't able to see the chat while I was screen sharing, so I'm just getting a chance to look at it now.
Yeah, I may start with the first one, which was actually me, and I see that Matt Maria has also kind of like responded in the chat, but maybe it would be just good to bring that that question so that everyone can hear. So I was just kind of like mentioning my question. It was interesting to see the lack of concerns about the well-being of staff in the hospitals, and so my question was that, you know, if you are aware to what extent or how this has been currently addressed, and if you are planning to perhaps repeat the survey so that you can see the trend, how the situation is improving for the staff.
Sorry, Andrea, I didn't hear that all well, but I think you asked the questions that you wrote as well. So yes, okay, yeah. So the hospital has taken some initiatives to increase the possibilities to get advices in connection with stress. We have a department for work-related like de-stress, and they have increased their capacity to take care of that. There's also been an increase in communication and more clear and strict ways of communication, because I think a lot of it lies in the way of communication. People get confused when different information is mixed into it. And also the whole area of involvement. I think that the staff are quite keen on helping, as long as they feel that they're part of the discussions. Some of them said in our survey said, okay, we felt like a piece in the puzzle, that the people could just bring us everywhere or anywhere, and they had no influence. So for the first wave, it was more like top-down decisions, and for the second and third waves, the staff has been more involved, and try to deal with it like in volunteer to do some of the work. So yeah, but still not easy. I would say you can't do everything by volunteerness. Yeah.
Great. Sorry, I'm just scrolling down. What was the other? Yeah, there was also the question about how the hospitals have actually responded to the results, and you know, if there were any results which were particularly surprising for, you know, for the staff and also for you as the research team.
I think we were quite surprised that the staff was more concerned about their family than about themselves, and the whole being scared of containing society, and being scared of being the one bringing virus home to your family and making isolation there, or that it would be your kids who brought the virus into the school, and that you were responsible for a whole school being locked down. And you know, that's some of the information that you can read in the news, that now we have had to close down a whole area of the city because some kid brought a vaccine in. So we're so scared about the family's health, but also about, I think, the shame of being the one bringing the virus out and into society. Yeah. So participating in this survey, they're actually quite happy, because we have asked the board of directors, of course, if they would allow us to do this survey. So they also took that as as a sign that the board of directors wanted to hear their opinion, and they wanted to see their words, and they wanted to do something about it. So they were quite happy about that. But
I wonder,
Satya,
sorry, I'm going to butt in, Mette, it's Nessa. I just wonder then, that makes perfect sense, but is there a difference in how senior managers respond to the survey and the results of the survey? Have they been broadly positive, or have they had different responses?
Yeah, as the senior staff has been, they've been happy for the information that we have given back. Of course, we don't know if they have addressed everything, and I also know that they haven't addressed everything, of course. But they have been better to say that there's something else, that the personal protective equipment, because the first focus was really on security. The whole area about getting things to work and having the patient taken care of, and then security. So it's only in the second and the third waves that we had to see, okay, there are some people here who are very, very concerned. They do their job quite well, but they're having second thoughts about things. So, and that's more like on a lower level of management staff to kind of deal with that. And I think that's done probably different across the hospitals. We have around 60 different departments here, and they had different strategies on how they meet the challenges in that area.
Thank you. I just wondered if Sarah and Claire, if you had any questions specifically for Mette, and I just with reflection, really, at least from our colleagues in Scotland who are working with staff in care homes, I'm thinking of in particular, that concern that you expressed, Mette, about bringing the virus to your family, or bringing the virus to the people you care for, rather than your own physical safety. That was something we heard a lot here from our colleagues working in the care home sector, because obviously the residents were most vulnerable. So Claire and Sarah, I don't want to put you on the spot, but I just wondered if you had questions for Mette after her presentation.
I was very interested in the findings that seemed to indicate that there were some positive developments that have come out of COVID. The news here is always very negative, and everybody's facing a mental health pandemic, and things are extremely difficult. But really, the reality that we're hearing is that there's a balance, that there have been some positive developments. So I was just interested that your presentation highlighted some of those.
And you're definitely true. There has been, just in the department where I am, we have 4 different units, big units, and normally they work quite silo because they're so high specialized. And for the first period, they had to close a lot of our activities down and change into the COVID staff, being COVID staff. And for the second and third wave, we have been starting the vaccine centers. So we are now having around 6,000 people for vaccination every day. And what they say is that now, 1.5 years after, or 1 year after, we feel a lot of togetherness. We know some of our colleagues that we never knew, and they were just on the door next side. So this feeling of this is something that we do together, that has been really, really good. And also people know, but that we have some colleagues that really step up. When everything is on fire, you can count on your colleagues because they are there for you, and we can figure this out together. Building a vaccine center, it was just something. It was just a closed school, and the department was given the task to say, well, build this into a vaccine center. You have around 2 weeks to do that. You need to make the IT systems. You need to hire new staff. You you need to find computers, you need like the whole scene, you had to set it kind of yourself. Of course, you can involve a lot of people to help you. So people work together on that, and that has been really interesting to do that. And of course, this is also one of the areas that's a lot of positive press at the moment. So that's kind of funny to be on the other side of that. Mm.
Thank you. Sarah, I don't know if you had any questions for Mette at this point, or Carrie?
No questions. It just hearing the research, it just seemed to reflect what we had been hearing when we had been running our helpline for staff. So a lot of what you were saying, Mette, sounded very familiar to the experiences that we'd had here.
Yes, so I think what we have been kind of uncovering, it really, what you have been doing is really one of the very, very interesting initiatives, I think, because you've really been addressing a lot of these inputs that we have found. So it's very, very interesting to us to hear that okay, this can actually be dealt with, and IT can support this. Yeah.
Okay, I'm just looking back at the chat. Andrea, forgive me, I'm not sure if you picked this one up already because I couldn't see the chat earlier, but you had a question, and there was a question about Australian hospitals, but I think Mette has replied, and some people might be in a position like me where they can't see the chat. So it's just to clarify if a question has been addressed. And it was about differences, I think, with the Australian staff and their response. Was there anything else on that, Mette, you wanted to pick up?
No, I say we're not completely similar. So you can see that the Danish nurses from the ground is maybe more robust than the Australian nurses. And why? We don't know quite why, because maybe something is in the education, maybe something in the way you're trained, maybe it's in who chooses to become a nurse. I don't know. So from the beginning, there's more robustness in the Danish nurses. Having that said, the Australian has also been hit way harder than the Danish hospitals. I mean, we made departments to be ready to have the patients, but the patients never really came in that big groups as we have feared. But in the Australian hospitals, the patients came and they were quite ill or very ill. So they had to, like their nurses, they completely went down with COVID-19 or had to go in isolation. So at a certain point in time, they had so many nurses put in isolation at home that the hospitals were like, what can we do to make this work? And people being more isolated in Australia due to the distance, they had to make some completely different systems that was required in Denmark. So they had to call their staff every day to check on the situation. They also had to make systems where they could send food to the staff, because they felt it was kind of their fault that they had to send the staff in isolation at home because the staff had been infected at the hospital. So yes, so a completely different situation in Australia, but also some similarities.
Yeah, that's really interesting, isn't it? That even with all of the differences, there will still be some similarities. But yeah, as you say, very different experience and different waves. And just a small point, your point about PPE and concerns about personal protective equipment. I can remember certainly here in Scotland, the anxiety and the media outrage and the stress in the first few months, really the first 3 months, 4 months maybe last year. Everything you heard about seemed to be about PPE. And then that seemed to be resolved, and then another thing. And yeah, it's strange now to reflect back on our collective experiences of this when it's so fresh, but it feels, at least to me, like so much has happened in the last 14 months or 16 months, I think now. Okay, back to the questions. Andrea, can you, is your audio okay? I wasn't sure if you were wanting to come in there.
Yeah, I think we can just follow up maybe with the questions for Claire and Sarah. So those, I think, Claire, you mentioned in your presentation specifically that one of the kind of challenges or mistakes which were done was about not incorporating that system to collect what kind of like formats the users potentially so are you planning to address this somehow in the future, or the same for the demographics that you mentioned?
Yeah, I mean, your audio went a bit fuzzy there, but I think what you're describing was one of the difficulties that resulted from setting the website up so fast. 3 weeks to create a website of this scale is unbelievably fast. So as a result of that, we didn't build in the analytic capability to tell us beyond the page that people looked at, what they then accessed within that page. So that has been one of the things that Sarah has been leading on, is redeveloping the website, restructuring it in a way that will allow that level of analysis. Do you want to add anything, Sarah?
Yeah, so the redesign, we're going to have a much clearer picture of what people are looking at, which resources that they're using. We also have a feedback questionnaire that people can complete, but we've had relatively low numbers use that questionnaire. And even with the redesign of the website, I'm not sure that we're going to get the demographic data that we're after. But with our webinar series, we are asking people when they book onto that, we'll be asking them questions about their demographics. So we'll get much more information that way. And in terms of communicating with the website, people email us. So when people have struggled to access a webinar, we're getting the emails from people, and then that's given us a bit of information. But again, it's not given us a lot of information about people at the moment. So we're hoping with kind of the redesign and the opening up of social media, we're going to have a much clearer idea of who's using the hub and all the resources.
Thank you. I'll just jump in, Andrea. So that relates, I think, also to a question about which formats people are preferring to use from the hub. So is it videos that people are mostly viewing, or is it reading about possible coping techniques, or is it just a mixture?
We just don't know. We don't know, because when they go to that page, we know that they're there on that page, but we don't know what it is that they're looking at. So the redesign, each time they click on one of those blue titles or a video, we're then going to know if that's what they're using, and that was the big challenge, is that we're being asked these questions and we just don't know at the moment.
But as you say, as Claire said, when we develop these systems in response really quickly, you're just trying desperately to get the information there, make it available to people. And that kind of iterative development sometimes has to come after the first go. I'm just asking, sorry.
I was just going to say, I think the good news is it really shows you what you can achieve if you really put your mind to it. And I'm currently involved in the creation of a website now for the whole of the general public of Scotland, again commissioned by the Scottish Government, and I've spent 9 months so far going through a procurement process, and I have yet to actually start the build of the site. So by comparison, what we did in 3 weeks was a minor miracle in my mind, but I think it's happened all over. It wasn't just the website, it's happened everywhere, that shortcuts were taken, and yes, there were possibly mistakes, but we achieved what we set out to achieve, and it just shows what you can do when you focus. And yes.
But the level of collaboration also, that was one of my questions, and I'm encouraging people, if they have questions, to put them in the chat or to come on and ask. But so I'll just take time while we do that. Was it did you find, I mean, this is a, sorry, a long-winded question. When it comes to the wider technology-enabled care, digital health programs of work, we've found certainly in the last 14 months that the existing relationships were so important to our ability to scale up services in digital health. So when you showed us that slide at the beginning with all of the different partners and reinforced the fact that the health and social care workforce is over 340,000 people in Scotland, you know, all the representative organizations, was that collaboration easier than you thought it might be because everybody was desperately trying to respond, or was that really challenging? You don't have to name names.
It was easier in the fact that the infrastructure was there already. The health and social care partnerships as entities were already there. There were already champions, well-being leads that were networked together. So in one email, you could be in touch with the whole of the landscape, the well-being landscape. And then they would cascade that request down to their colleagues within the partnership. So the infrastructure was there, which made it easier. The fact that the requests were coming from the Scottish government, I think made it easier because there was a urgent, bold in red, respond query or request being made, and we were very persistent. If people weren't responding to us, we just kept going until we got the information from them about their local services or their needs or whatever it was. So yes, it was easier than we expected, but very, very demanding, and you have to persevere and be quite tenacious to get the information, I think.
Okay, thank you. That's a really good response. Meta, I just wanted to offer you the opportunity, since Sarah and Claire had the opportunity to ask you questions. Was there anything you wanted to ask specifically about their presentation? I'm seeing Claire's cat. I'm glad you can't hear my dog snoring beside me, because that is exactly what he's doing. You're lucky he's not barking. Sorry, Meta, did you have any question for Claire or Sarah?
Yeah, I'm very impressed of the work you have been doing on so short time. So, and I'm also a bit curious if you had the possibility to involve the users in the development, or if not, if that's of course understandable, but if there's somewhere where you think, okay, that could be interesting for that area to involve the users in the development, then that may be something that we will do in the future. Or yeah, just to hear your thoughts on that.
We did right from the start. We had a reference group of service users, of staff, and we would, any aspects of the design that we weren't sure about, so even down to the way the website looked, the colors we were using, the graphics we were using, the way that it was structured, we would put that past the reference group. So we did involve them, and as Sarah said, there's also a feedback mechanism. There's a questionnaire on the website where you can give direct feedback, and we've tried very hard to respond to that, and any suggestions or comments, criticisms, positive feedback, negative feedback, whatever it's been, we've tried to respond to that and make changes to the website in response.
Okay, thank you.
Thank you. And how was the whole collaboration on the management level in connection with this? Yeah. Also, I'm just curious about the development, you know, using the bottom up, but also how to use this from the more top-down level. How was the management? How could you involve the management in the whole processes, or that was not really necessary in this area?
It wasn't really necessary, and maybe that's one of the reasons why we managed to do it so quickly. We were given, when the Scottish Government commissioned us to develop this website, we were given a large amount of autonomy and just asked to deliver as quickly as possible, given a deadline, and left to get on with it, really. So yes, I think that's probably why it happened so quickly, because we didn't have to go through the usual mechanisms of getting approval and management sign-off for every stage.
I think as well, you mentioned the network of well-being leads. If you had those people in place already to be supportive of that decision making, I'm sure that must have make a difference. Andrea, you put a question in from Cassia, is that right? Hiya.
Yeah.
Just saying congratulations on the hub. Was it possible to do it in 3 weeks because you used your own internal resources, or did you hire in everyone externally, for example, the IT providers, the developers of the website? I think you mean, Kasia, yeah. So Sarah or Claire?
Yes, we contracted a local IT company to do the actual build of the website, but all the content was developed by a small team of clinicians. There were 4 of us, 2 from the River Centre, which is the Edinburgh Trauma Service, and 2 from the Anchor, which is the Glasgow Trauma Service. And between us, we wrote all the content. A lot of it was there already, to be fair, and we needed to tweak it, convert it into a suitable way so that it was consistent, so it looked as though it had all been written by the same person. So there was a lot of writing involved, but we did all of the content in-house.
Thank you. And a question, I think, to all the speakers from Diane. Hi, Diane. I don't know if you wanted to come in yourself, Diane. I'm happy to read out the question. If you're, oh, there we go. Hi, Diane. Oh, we saw you for a moment. Back again. You're on mute, Diane, just to.
There we go. Does that work?
Perfect.
Oh, it's super to see you all, and such an enthusiastic little team. Sorry I came an hour late. Because what you work in is social media or things that are internet and web-based, I've been attending a fair few things recently that are WHO-led around misinformation and miscommunication and campaigns to fight against that. Obviously quite vaccination orientated, but I just wondered to what extent you experience in the mental health field miscommunication about what the causes, what the effects are, and how much you've had to be fighting that during this 12-month course of operating the website. Be really interesting just to know that. Thank you.
Thank you, Diane. I don't know who wants to pick that up first. It has miscommunication or myths about, I can't say that properly, myths about COVID. Has that been a feature of the information you've been dealing with? Claire or Sarah, would you like to?
I mean, it's there most definitely, particularly in the social media side of things. But I think what we've tried to do is indicate that everything on the hub is based on evidence. And there's a whole section where that debate goes on about what COVID's about, where it's come from, what the best responses are to it. So the academic debate and all the research underpinning, all the findings underpinning that narrative are all on the website. You can go to the hub, look at the evidence-based research section, and it's all there. So we're trying to highlight the reliable sources of information. I know that the government is simultaneously or has been running a number of different campaigns, not just on TV, radio, but it's on social media as well, that are specifically aimed at counteracting some of the misinformation. So you'll see some of those, and they're particularly aimed at different vulnerable groups. So there are campaigns working with the BAME communities, for example, counteracting some of the misinformation among those communities. So it is actively being challenged, the misinformation.
And
I would just add in, because I'm aware of it through some work we've done, that in Scotland, at least the Young Scot charity, they've had an excellent COVID resource information and very frequently updated how they've managed to do it, really, in response to almost every new government, level or information that's coming out. And that's really widely accessed nationally by probably from the ages, I think, are expanded to what they officially say. So it's probably from ages 11 up to 18. Really good, clear, consistent information that they've shared. The WHO work, I don't want to kind of go off topic, but that's something that I found really interesting. I was listening to some WHO presenters recently talking about social listening. I think they describe it as, Diane, where they kind of consistently have an algorithm behind it, but they consistently review and look at social media content on misinformation on COVID, and they're able to then tailor some of the information that they prepare to respond to that, so that a particular urban myth blows up on social media and they can try to respond. It's a fascinating area, and I'm sure it applies beyond COVID. But I suppose the other fact here is that we're talking about staff, for Meta and for Sarah and Claire, we're talking about staff who are, directly in the eye of the storm. Not to say they won't be curious about misinformation, but perhaps they have a different take on that because they're dealing with it every day. So I don't know, maybe. There was just another question come in again. So you mentioned that 100,000 people have visited the hub, the website, in the first year. How is the information being shared? Yeah, it's really interesting, actually. How are you disseminating or raising awareness that this place exists? And has there been an information campaign at a regional or even a national, I would add in, level? Sarah?
Yeah, so I think initially posters were developed and were sent to hospitals. However, hospitals wouldn't put the posters up because of the risk of passing on infection, and so that was shelved. Twitter has been used a lot to promote the hub, and the feedback with the wellbeing champions has been used. But more recently, we've had a campaign on social media. So it's something that we are kind of constantly looking at and trying to raise awareness. And we regularly send out tweets to either, I think it was Carers Week, so we sent out tweets suggesting people visited and looked at specific resources, and kind of moving forward with the use of our social media, we're going to be able to use those platforms more to kind of promote the hub going forward.
Can I just add that one of the questions we asked in the survey that's on the hub is, how did you hear about the hub? And consistently, the biggest route was through their management. So through some sort of email communication from a line manager or some local newsletter or a local mechanism. So that's informed our marketing and the use of various networks to advertise it.
Thank you. That's really interesting. And I'm just checking, sorry, Andrea, if you wanted to come in. I was just checking back if there were any other new questions. I think, Meta, this may have been posed earlier, but in terms of potentially repeating the survey, is there value in repeating it, is the first question, because it's about a very specific point in time, or are there elements of it that you would really like to follow up in terms of the response, some of the responses that the staff gave to certain questions? That's been in the back of my head, sorry.
I definitely think that there are areas worth looking into on a more deeper level. I think at the time where we sent out the survey, people were quite desperate and frustrated about the situation. And I think that's why we got so high response in so short time, whereas the Australians got a lot less response to their survey. So I think if we repeated it now, we probably wouldn't get the same responses. So I think if something should be done now, probably we should do some more qualitative interviews with groups of nurses and midwives instead. That could be one thing. The other discussion has been, why didn't you send it out to the medical doctors as well? And that was actually done in Australia, but we didn't felt that we had the time to do it at the moment where we did it. But that could also be interesting to include more broad groups. And then, of course, we could adjust the questionnaire. Yeah, so definitely it would make sense. And maybe we will do it in certain time. We're still working on the data and making cross analysis, for instance, analysis where we can see that who are the most frustrated, who are and linking that with, for instance, where you work. So people who work in an outpatient clinic, they get more frustrated than people who work in an intensive care unit. So it's easier to move people who work in an intensive care unit than it is to move people who work in outpatient clinics. So stuff like that is some of the things that we're looking into right now.
Sorry, I was on mute. That's really interesting. Thank you. I think, Andrea, you had another question. Will we try your audio about the hub?
Yeah, I'll try. Can you hear me okay now?
Yeah.
Okay, perfect. Yeah, I was just kind of like picking up what we've mentioned earlier a bit, that obviously the hub was the very quick response to COVID-19 situation. And, as the situation evolves, hopefully improves, are you kind of like expecting the hub will keep going, or, what are the future plans, or what's kind of like that bigger sustainability around the hub, or, have you got any thoughts around that?
So the plan is that certainly up until March next year, the hub will be there, and we are moving away from a COVID-19 focus to it being a well-being hub, and that's how we would like to see it moving forward, is it being a generic well-being hub for health and social care staff and unpaid carers. We'll see how the funding pans out for that.
That makes sense.
I think we've answered everybody's questions. I think.
I think so as well.
Okay, Andrea, shall we?
Yeah.
Okay, I'm not going to keep people unnecessarily. we don't have to stay till the half hour.
Indeed.
Sorry, Andrea, I cut across you there.
No, I was just saying that if there's no more kind of like last minute question, I see something from Dan. Sorry to popping up. Dan, do you want to maybe come in as a kind of like last final comment before we close?
Sure. I was thinking about the aspect of living life as a health or as a care professional. I think there are two things that are coming up in England at the moment, which is where I'm based. The one I mentioned in the chat was that as people and patients are going back to their general practices, the staff from receptionists through to doctors are really seeing a kind of resurgence in aggression, verbal and some physical aggression. So that's a worrying trend that's really now just starting and starting again. And I think the other thing really is now the focus that's going back to people who work in the care sector in particular, and not just people who work in care homes, but people, there's a lot of mobility in the care sector, certainly in England, i.e. carers who go from home to home to home, or household to household to household. And because of discussions about the way in which perhaps vaccination may be handled, I think here I'm talking at least about England as a home country. I don't know how much the whole of the UK will be implicated. But there's considerable worry about dropout from the field and from the sector. So I think the work that you've done in Scotland, amazing work that you've done in Scotland. I'm pretty sure that there are ongoing problems that will need resolving through either a hub or social media or the internet generally. Yeah, I feel it's really invaluable work. And I'll stop there. I just want to congratulate you, and sorry I didn't attend the first hour.
Thank you, Diane. That's really kind of you. Well, Andrea, I'm sure that that's a whole area that's, you know, the impact on staff well-being and the impact on staff in the longer term, and whether it makes an impact in Denmark, in Scotland, in Australia on early retirement. I found out last week my GP has retired and she's the same age as me, and that really shocked me. I thought, what? You can't do that. So yeah, I don't have no idea why the GP retired, but I'm being a little bit flippant, but I absolutely agree, Diane. I think we have no idea what the impact in the longer term will be on the workforce and their decision making about their job. So maybe that's a future discussion we can have. So I just want to say thanks very much to our speakers, to our presenters, to Mette, to Claire, and to Sarah, and to all of you who joined us and who contributed to questions and to the discussion. It's been absolutely fascinating, and an area where I think we, you know, genuinely we would like to perhaps come back to, and in another 6 months or 12 months and see how things have developed and what shape they've taken. So thank you again. Andrea, any final words you want to?
No, just a big thank you, as you said, to our speakers and to all participants, and thank you for sharing your experience and knowledge. And as necessary, we still have a few months in the project to keep exploring this knowledge exchange activity. So it might be that you know, we will continue discussing this topic further. So thank you so much.
And thank you for putting focus on this topic. So that's very, very nice. Yeah.
When it's published, just as a final, when you're published, Mette, I'm absolutely sure our health and care colleagues and nursing midwifery, perhaps in particular, would be really interested. So
I'll share it, definitely.
Thank you.
Thank
Bye,
you
everybody.
so much.
Thank you.
Goodbye. Bye-bye.